A very good morning to everyone. Today we have a demo on peritoneum. So let's reflect the muscles of anti-abdominal wall. You can see the interior of the abdomen, which is covered with the help of peritoneum, which is a large serous membrane which covers majority of abdominal organ, which consists of two layers, that is parietal layer and the visceral layer. So parietal layer is formed by fibroelastic tissue and visceral layer is lined by simple squamous epithelium, which helps in production of peritoneal fluid between the parietal layer and the visceral layer, that is within the peritoneal space. Now we have to know about the peritoneal fold, or let's classify the peritoneal fold into three types, that is ligament, omentum and the mesentery. So let's start with the ligaments. So can you see here the huge organ? You can see here this is the liver, and in between the right lobe and the left lobe of liver, this is falciform ligament. So this is right lobe, on the left side we have the left lobe. Now this falciform ligament is attached anteriorly with the anterior abdominal muscles here. Now if you trace the falciform ligament, so we will trace as coronary ligament. So we have the right superior and the left superior, as well as the inferior coronary ligament, as well as the right triangular ligament and the left triangular ligament, which is attached to the diaphragm. So you can see the muscular structure here. This is the diaphragm, which separates the thorax and the abdomen below. Same how we have the other ligament related with the liver is the ligamentum teres hepatis, ligamentum venosum. We'll discuss later. This is the stomach here, and even we have to know the ligament related with the stomach here. So we have done with the ligament portion here. Now we have to even know about what is omentum, right? So the omentum will be mostly related with the stomach, and let's know the omentum which is related with the stomach. Now let's raise the liver here, and we'll see the stomach over here. So can you see here, this is the stomach, which consists of the greater curvature. So this is greater curvature and we have the lesser curvature. So within the greater curvature, you can see here the attachment. This is known as greater omentum, and which is also known as policeman of the abdomen. This is known as the lesser curvature. So we have the attachment of lesser omentum here. So these are the two things which is attached to the greater and the lesser curvature. Can you see here? This is something known as the transverse colon, and the transverse colon is suspended with the help of transverse mesocolon here. So this is the structure which is holding the transverse mesocolon. Same how you can see here, these all are the coils of the small intestine, that is the jejunum and the ileum mostly. And this jejunum and the ileum is holded with the help of, or suspended with the help of, the term known as mesentery, and which is holded in the oblique pattern from the duodenojejunal junction to the ileocecal junction, which arises from the left side towards the right side. Now you can see that this is known as the transverse colon here, which divides the compartment into supra-colic compartment and the infra-colic compartment, which is a part of the greater sac. So let's know about the infra-colic compartment. So the infra-colic compartment is divided with the help of the intestine into right triangular, the infra-colic compartment, and the left quadrangular infra-colic compartment. So we have the root of mesentery, and just towards the right we have right triangular, and towards the left quadrangular infra-colic compartment. Now can you see here on the right side we have the term known as the cecum with ascending colon, and near the cecum you can see here the structure that is known as the appendix. So this is known as the appendix, which is attached or suspended with the help of the structure that is known as mesoappendix. Now along with that, I have to show you about the right paracolic gutter. So can you see it? This is known as the abdominal muscles here. So in between the abdominal muscles and the ascending colon, so there is a space known as right paracolic gutter. Now on the left side, this is the descending colon and the abdominal muscles. So this is known as left paracolic gutter here. So let's know about the supra-colic compartment. So for that we have to know about again the transverse colon. So just above the transverse colon we have the supra-colic compartment, and above you can see here this is the diaphragm. So in between the transverse colon and the diaphragm we have the subphrenic space, also known as the peritoneal compartment. So total 6 peritoneal compartment which is present between the diaphragm and the transverse colon. So for that we have to see the liver and its ligament. So this is the right lobe of the liver, and this is falciform ligament over here, and that side we have the left lobe of the liver. So there are 2 intraperitoneal compartment and 1 extraperitoneal compartment towards the right side of the falciform ligament, and again 2 intraperitoneal and one extraperitoneal compartment towards the left side of the falciform ligament. So let's know about those three spaces towards the right side. This is the right lobe of the liver, and above we have the diaphragm, and again on the left side you can see the falciform ligament. So wherever I have inserted here hand, and this area will be known as right but anterior intraperitoneal compartment, so which is bounded by the right lobe, falciform ligament and diaphragm. Now I am inserting my hand on the back side, so this area is also known as the right but posterior intraperitoneal compartment, also known as hepatorenal pouch of Morrison's, also known as the Morrison's pouch, because here we have the organ known as kidney, that's also known as Morrison's pouch. Now if you trace this falciform ligament, above we have the coronary ligament, that is the superior and inferior coronary ligament, and the right triangular ligament which is above attached to the diaphragm. So that's why we can say the extraperitoneal compartment of the right side. So total 3 compartment done. Now towards the left side, this is the falciform ligament. Towards the left side of falciform ligament, I am inserting the hand over here, that is known as left but anterior the intraperitoneal compartment. Same how on the back side, this is known as left but posterior intraperitoneal compartment, and again above if you trace here, we have the coronary ligament and the left triangular ligament which is attached to the diaphragm. So we can say the left the extraperitoneal compartment. So these all are the 6 spaces which is just present around the liver, or we can say below the diaphragm or above the transverse colon. So this everything is a part of the greater sac. Now we have to know about the lesser sac, right? So this is the liver which is having anterior, posterior, and this is known as the inferior surface and right lateral surface. You can see the green color pouch over here. This is known as the gallbladder. So this is something known as the gallbladder. So whatever we have studied till now, that it is a part of the greater sac. Now we have to know about the lesser sac, which is just behind the stomach, this lesser omentum and the greater omentum. So there is a communication area between the greater sac and the lesser sac. Now let's know about the communicating area between the greater sac and the lesser sac. So I will insert a finger over here. So this communicating area is known as epiploic foramen here. So we have to know about the boundaries of epiploic foramen, that is by the margin of the lesser omentum, which consists of hepatic artery, portal vein and the bile duct. Now on the back side we have the boundary which is formed by IVC, inferior vena cava, and above it is bounded by the caudate lobe of the liver, and below by the duodenum, that is the first part of the duodenum. So this is the boundaries of the epiploic foramen. So let's know about the boundaries of the lesser sac now. So we have anterior and the posterior boundary. So anterior boundary is formed with the help of the lesser omentum with the caudate lobe, stomach, and the 2 layers of the greater omentum which is attached to the transverse colon on the back side. Can you see here? It is attached to the transverse colon. So these all are the anterior boundary. Same how we have the posterior boundary which is formed by the stomach bed. So except the spleen, everything will form the posterior boundary, that includes kidney, left suprarenal gland, the pancreas, splenic vessels and the transverse colon over here. So that is all about the posterior boundary of the lesser sac. Now let's know about the spleen over here in the left side. Can you see here the organ here, that is known as the spleen, which is attached with the help of the gastrosplenic ligament over here, and just behind the stomach there is a term known as the pancreas. So this is all about greater sac, lesser sac, the boundaries of the epiploic foramen and 6 spaces below the diaphragm. Thank you.